Well, hello, everyone. We have Dr. Alanzi with us today to discuss urology, men's health, and how establishing regular health care with a urologist can be a great step for men in monitoring and managing their overall health and well-being. Well, thanks for joining us, Dr. Alanzi. First of all, tell us a little bit about what a urologist focuses on in the body.
Well, thanks for having me, Chris, today. We, as urologists, we look at mainly the urinary system, so the kidneys, the bladder, and the prostate. We also look after care for men's health in general. So that's the manhood, including testosterone and other manly function, including erectile functions.
All right. And so what is the role of a urologist in men's overall health and well-being? What do you do?
So, as many diseases in the body, urologic diseases are a reflection of lifestyle, and so including diet, exercises. The healthier you are, the less disease potential as you can get. So, starting with, like, let's say for kidney stones, for example, lifestyle has a huge effect on that. So, even starting as early as children, we see an increased rate of kidney stones in children. Secondary to food rich in sodium and sugar, and that's definitely more common in adults, which contributes to like insulin resistance that affect, I guess I said, kidney stones and also prostate enlargement. Now, obesity, that's one of the major consequences or diseases of lifestyle, also results in affecting the testosterone level, affecting men's or men's in general health. Also long-term, it affects increased chance for prostate cancer. There was studies, actually interesting studies showed in East Asia, the risk of prostate cancer is much less than in the US. However, those immigrants, they move to the US, after 20 years, their risk of prostate cancer becomes equal to the people who are born and raised in the US. And that says a lot about environment and lifestyle.
Right, I've heard that as well. Well, how can regular urological care visits contribute to the prevention and early detection of serious men's health issues?
Yeah, so the guidelines are a little bit different nowadays, but starting with the age of 40, especially if you have a family history, a father, a brother, a first-degree relative that has prostate cancer, or if it is more common in the maternal side, so if you have a sister, a mother has ovarian cancer, uterine cancer, then we recommend coming in to see the doctor early with a primary care doctor or urologist, starting at the age of 40. If no family history, maybe 45 or 50. Sometimes simple tests as PSA, which is prostate-specific antigen, and used in the right context, it can reveal a lot of information about potential cancer or give us an early advantage of treating that if in an early time.
Right, it's very important. Now, if somebody would really like to just establish a regular care with you, let's say, how can they get started?
Sure, they can just call our office, and the nurses we have here are fantastic in guiding you which direction you need, and we're very approachable. Anytime you need help, we're here for you.
All right. Well, thank you so much, Doctor, for joining us today. A very important issue that we like to discuss. So thank you once again. And don't go away. We have more when we return.